I'm Naomi Waithirangugi. I work at Haven Hospital as an ICU nurse. And briefly, I would like to explain what it means with an ICU setup for a COVID-19 patient. And in a COVID-19 patient, for one patient, we have to have a bed, we need to have a monitor, we need to have an oxygen cylinder, and we need to have a ventilator. All these appliances come with different prices. For the monitor, it's around 150 to 250,000. For the ventilator, it's around 3 to 4 million. For the bed, it's around 150 to 250,000. And also for the gas cylinder, it's refilled daily. And you can't have just one cylinder beside the patient. You have to have like 5 cylinders. Because when one gets done, you don't keep rushing outside to get another cylinder. So you get all these things. If you combine the prices, it's too much expensive. It's approximate 4 million and above to manage a COVID-19 patient. And despite the appliances, because there are also other appliances that are not here, because the more the patient deteriorates, that's when we come with other appliances, then they are all expensive. So apart from the appliances, with the COVID-19 for just one patient, we have the medical professionals that attend this patient. For one, we have to have a physician, we have to have a nurse, we have to have a lab technician, we have to have a cleaner, we have to have everyone, even the cook, because this person who's cooking for the COVID-19 patient can't cook for the other people. So you find the hospital have to hire extra personnel at a higher price, because you see, for this patient to be served, for this nurse who's coming into a COVID-19 room, she has to ask for an extra cost, because you can't risk for an ICU room with 1,000. Eventually you ask for more money because you're risking your life and the life of your relatives. So you find managing a COVID-19 patient, from the appliances to the labor involved, you find that it's too much. It's even more than that 4 million. You may find it's about 7 million Kenyan shillings. I know most people wonder why ICU services countrywide are a bit more expensive as compared to other conditions that are managed out of the ICU. And the reason behind it is because of the appliances used to manage just one patient of ICU. So, like behind me you can see there is a monitor, there is a bed, there is a ventilator, and there is an oxygen cylinder. That's just to serve only one patient. And in that patient, you may find it's only one nurse who is assigned to attend the patient. So you can imagine a scenario where you have like 10 patients. So you have to have 10 nurses, because this person needs a nurse bedside, because the situation can deteriorate when the nurse is serving another patient. So you see that the labor is expensive. Also, more staffs are needed, and the more staff are needed, the more the money is spent to manage a patient in ICU. Cumulatively, to set up a one ICU unit in Kenya, it will cost you around 4 million and above for just one patient. And that explains to you why in Kenya ICU services are a bit expensive as compared to the other countries.